welcome everyone to the Premed Lifeboat podcast. Today in our midst, we are very fortunate to have Dr. Susana Rita Morales here with us to talk with us, and also about her experience so far in primary care and being, a trained internal medicine physician. Now, quick intro of Dr. Morales is that she was born and raised here in New York. She attended public schools and then attended, Harvard University, where she received her AB degree in biology. She also obtained her medical degree from the Columbia University College of Physicians and Surgeons, and did her residency training, as I said before, in internal medicine at Presbyterian Hospital of the city of New York. She then joined the faculty of the Division of General Medicine at Columbia Presbyterian in 1989. I wasn't even born yet, which is crazy. And served as an assistant division director for education and training. She also coordinated primary care educational efforts and co-directed a student course focused on psychosocial issues in medicine. And so today we're gonna, dig into stuff like that today. But also to talk about her honors. She is a recipient of numerous honors, including the J. James Smith Memorial Award, presented annually by Cornell staff, to a member of the attending staff who exemplifies the qualities of teacher, scholar, and physician, and of the National Medical Fellowships Community Service Award, which presented for extraordinary commitment in the area of public health. Welcome today, Dr. Morales. We are, very fortunate to have you with us. I know for sure how busy you are, and so thank you for making time to talk with us.
Well, thank you very much for inviting me. I'm honored. I'm a Bronx girl originally, and so I'm happy to be doing something with Lehman. With you.
Thank you. We appreciate it. And so, we're just going to dig right into it. Okay, so first question for you, Dr. Morales, how did you get into medicine? How did it all start? Did you always want to become a doctor growing up? Just how did you gain interest in medicine in particular?
Yeah, so I think everyone has a different path, but for me at least, a lot goes back to my parents, as for so many of us, their influence. My mother is a retired nurse. She actually became one of the first nurse practitioners in the 70s. Nice. And her first nurse practitioner job was at the Dr. Martin Luther King Jr. Health Center in the South Bronx. And she was involved in community health, for most all of her career. She was probably the first Latina at her nursing school, although I don't know for sure, but certainly one of the few. And my dad was a community organizer and then became a health administrator and spent his career also in the community health movement and in safety net hospitals and public hospitals through his career. So I grew up listening to them talk about community health issues around the kitchen table. And when later on I became interested in science, but I was also interested in social issues. I realized that as a doctor, I could be involved in both. And so I think that, I was lucky to have wonderful science teachers, and I don't think that we, I hope for any future teachers that may be also listening.
Yes.
There's no question that that our teachers affect us for life. And the one that I want to give the shout out to from way back when is a biology teacher I had, Mr. Reynolds, who was very inspiring and sparked a lot of that fascination with biology.
Right. That's pretty cool to hear, Mr. Reynolds, or wherever you are. Shout out to you. That's pretty cool. That's pretty cool. So pretty much you growing up, you kind of had these kind of influences. Was there any moment where like it kind of hit you, where you're like, yes, okay, this is the moment. This is the reason why. Like very, or this is the moment where I feel like this is my call, and pretty much was it like a specific class, like you talked about, maybe biology, or like a specific experience that you experienced for yourself?
I think in high school I did very well in science and enjoyed it, and so I think that whole science curricular exposure was very helpful. So I did enter college as a pre-med. I mean, not everybody realizes it then, but for me, that's how it worked. And actually, I talked about my family influences,
Right.
and about my love of science and so forth, I think in my college application. But the challenge then became college. And so, because I think it's good to talk about the up notes,
Yeah.
but I think one of the challenges for many of us is then you hit the college level courses, and that was, especially when I first started out in college, was challenging. And so one of the messages I want to send to your listeners and to other college students and pre-meds out there
Right.
is to not be discouraged or don't get knocked down, because I think that what you see sometimes happening is you go from high school to college where you have all these other pre-meds taking these courses with you,
Right.
and sometimes elbowing you out of the way a little bit, and people get discouraged and drop out. Now, maybe not everybody should be a doctor, and there's so many different ways to serve humanity and to
Right.
have a great career and a great life, but it shouldn't be because your intro level science courses end up being bugging you.
Right.
So I would say just hang in there and persevere. One of the mistakes I think that some students make also is taking 5 million intense science courses in their first year, which is not a good idea. And I would say that freshman year, you really kind of want to get into the swing of studying for college classes, which is totally different from high school. And
Totally
also, yeah, and also to getting your buddies together, your group, so that you have study group, study partners, fellow travelers in this crazy life of pre-med, so that you have that was really important for me, is having other, developing my friend group that was also going to kind of go on this journey with me.
Right.
And so so I think especially young people have had an especially challenging time now with the pandemic. Many people have been sick or lost family members, or and are stalwartly proceeding in their studies, but just to take a breath and realize that you guys have been living through an extraordinarily awful time.
Absolutely. Thank you for sharing. All right, that is great to hear, because I was just going to transition to ask you about Harvard University, and also transitioning from that to Columbia University College of Physicians and Surgeons. Just how that transition was like, comparatively, and also how did you kind of navigate your way through, I guess, the rigor of courses, and just like of things in general, with your time.
Yeah. Yeah, I think no matter where you go to college, it's a big transition. But definitely for me, it was a big transition. And in retrospect, I had a couple of issues. For me, at least, I was living in college, so if there's pros and cons of commuting versus living in the school. But first time you ever lived on your own, and that you're completely free and all that stuff, it's a lot. that you have to control your own time, that you have to, self-discipline. Nobody's telling you to do your homework. It's like you have to do your homework, all that stuff. So, so that was a transition, I think. But I think I also had a lot of fun, and that was good. But I also got very involved in campus politics, and that was interesting as well, because we had a Latino organization, we had a kind of pan-minority student organization called the Third World Center. One of the big struggles at that time in our school was about divestiture from South Africa, because that was still under apartheid. And many colleges had money invested in companies that did business in South Africa, and one of the movements internationally was pushing organizations, institutions to not invest in as a sanctions. It's called sanctions. To disinvest from companies doing business in South Africa to influence the end of the apartheid regime. And so that was a very big movement in our campus and in a lot of college campuses to try to push big institutional funds to disinvest. So that I got very involved in that also. And so that's always, I think that every era has its movement that ebbs and flows. And right now there is, the Black Lives Matter movement. There are other racial justice and social justice movements that are happening. And I think one of the challenges for those of us that are interested in lots of things, including pre-med, is how do you balance you have to take care of business academically, but you also are still a human being in the world, and you want to, have your voice heard. And so in the end, it was a challenging balancing act, but I think that what you learn from being involved in organizations as an undergraduate student, whatever organization it is and whatever activity is that you want to focus on, are lessons that you're going to have later. And so I think that in terms of how do you work together to build consensus, how do you work together to express your values and so forth. And I think that, one of the things for me as a doctor, and I think for many of us as doctors or future doctors, is that medicine, is one of the tools to go for justice. And so I'm very glad that I was deeply involved in that. So I think there's a temptation to just shut yourself up in your little bubble and just do your pre-med courses, but in the end, there's a payoff if you also look more broadly around you, and it's not either or, it's both and. Right.
And so I guess that leads into my next question. How do you, talking about balancing, these various types of social issues, happening around us each and every day, how do we balance that, as pre-meds, or I guess how do we get more involved in these kinds of social issues while also balancing that with our studies, or even how do we get more involved in that on a second note in medicine particularly?
Yeah, I mean, in the end, you have to get your studies done. So it's not that you throw everything over just, and only focus on the other stuff. But it's, I think that there's a lot of pressure. I mean, everybody has to individually prioritize what they need to do at that time. Absolutely. So one of the challenges, for example, is there's a sense of intense urgency around some of these issues, around all these issues appropriately. But this is a marathon, not a sprint. And so there may be times where people have to, part of the balance is knowing when to temporarily withdraw from stuff and just buckle down and do the work, the schoolwork. And then when you can reemerge, and so it feels uncomfortable to have to do that, but sometimes you just have to do it.
Right.
Unfortunately, these struggles have been around for many centuries, actually, and will continue. It's not an overnight thing, and I think that one of the most revolutionary things one can do is to get a college education and a medical degree. So that is worthy in and of itself. But I do feel that it can be nourishing to be involved in other stuff, and what that other stuff is going to vary by the individual, whether it's just, whether it's tutoring,
right,
whether it's leading a group like you're one of the leaders of your group, whether it's, or whether it's doing something broader in the school or external to the school. I mean, I think there's so many different ways to make a difference.
Right.
So there's not one formula. You have to think about what it is that's most, nourishing and compelling to you at that moment. And then, realize that there may be, different phases and different things that you do over time. As a medical student,
yes,
we had a Black and Latin student organization, BALSO, which is still at Columbia, which I was also very deeply involved in, and which was also very important in my emotional support for the rigors of medical school.
right,
And later in medical school, I also got involved in a community organization called the Washington Heights Health Action Group, because that was trying to help to expand community health centers in Washington Heights in northern Manhattan, where the school is. So, so I think those activities were really important. And I also got involved. There was a young adults clinic where medical students were trained to be contraception counselors and talk about sexual health and contraception and stuff like that with young people. So that was also very helpful, because it the way that our medical school was structured in those days, there's very little clinical contact in the first 2 years. It was very like basic science in the beginning, and then finally you got onto the wards in third year, and you hardly ever saw a patient. But the young adults clinic allowed us to actually have our first introduction to patient care. And as an undergraduate also, I worked in a community health center, right, and I was trained to be a community health worker, and that was also very cool. Right. And another way to that I got exposure to the medical setting. So so there are different things. There's so many different things that one can do. I know that one of the challenges right now for pre-meds is just the clinical shadowing opportunities have dried up because of the pandemic, but I think there are other ways to demonstrate your commitment to community and to humans.
Absolutely.
Without only shadowing.
Right.
But there were also times in terms of just the rigors of the curricula that I had tutors. There were some courses that really I struggled with, and I think one of the other pearls that I want to transmit to the students is that there's no shame in getting additional tutoring or additional academic help. And I think that one of the mistakes that people make is waiting to the last second, like right before the final, and then they're panicking, rather than seeking assistance early, because just everybody learns in a different way. And one of the challenges with college is a lot of times there are these big survey courses where it's a big lecture hall. That was how like my bio class had like a couple of hundred students. It was very impersonal. So you go from high school where maybe there's like 20, 30 kids to 200, 300 kids in a lecture hall. It was really foreign to me. And so I really struggled with that. And so I got tutoring at multiple steps along the continuum. So, and there's, now as a faculty member, I've gotten very interested in this whole notion that people call either intrusive, kind of a negative term, intrusive academic support, or I called it proactive academic support, that really, why not provide study skills training and other stuff to students early in the courses just to get them started, so that you're not intervening when they're in trouble, but you're doing preventive intervention.
Right.
So that's something that I'm very interested in terms of educational support. I think that that's really key. And
Wow. Yes.
some of these struggles can happen as an undergrad, it can happen as a medical student, can even happen as a resident, because residency is like a whole other kettle of fish. And at each moment, really smart people may need some guidance and some support.
That is very true. We all need help along the way.
Yeah.
So never feel like not asking for help. Always ask for help. We all need it. Definitely.
But it's an issue because I think people sometimes feel like it's humiliating, or an admission of, inferiority or whatever. No, I think that it's actually, acknowledging that every brain works differently, and it's really a systemic issue that our educational system is frequently not student-centered, and does not always adhere to principles of adult learning.
Right.
And a lot of times students will like beat themselves up, but really, maybe you don't have a very talented instructor. I mean, there's so many, and then sometimes the content is just very ornate and arcane and complex, and the methodology that we use for instruction doesn't always appropriately reflect that. So instead of students beating themselves up, they need to think about the systemic issues, whether it's the content, the structure, the instructor. There are many other factors. Don't assume that there's something wrong with you.
Right. I used to have that same problem. Right. Whereby, especially like early on in my college career, not asking for help, not going for tutoring sessions, like thinking that, hey, maybe like all that stigma that comes with it, or like, hey, I'm fine, or that such a thing as that. But I have grown to know that it is quite essential to ask for help, and that is why they are there, like to help you.
Good.
And so yeah, guys, don't be afraid to ask for help. Okay, we all need it for sure. So Dr. Morales, you talked about ways of getting involved during the pandemic. It hasn't been easy in terms of like shadowing experiences. All that has been cut out. Obviously now with the mass vaccination going on, especially here in the United States, we still have a lot of work to do in terms of like worldwide vaccination. But in terms of the United States, and even here in New York now, cases of COVID-19 are comparatively to last year lower, and very low. And so now these kind of opportunities are getting like shadowing and stuff are kind of coming back slowly. But in your recommendation, what are some ways that pre-meds out there can get more involved in the medical field and kind of get more experience?
I think there's way more interest than there is capacity for shadowing.
Right.
Unfortunately, as you know, there are lots of different organizations. I think that every institution is opening up at a different rate. So I would say that volunteering in a healthcare institution, if that's available to you, is one way, just to get a little foot in the door and a glimpse of what's really going on.
Right.
But you mentioned the vaccination issues, and this is an obsession of mine, COVID vaccination. I've been, what I realized last December when the vaccines came out was that there was, that's when I don't know why I think it was kind of naive that I was surprised, but I was surprised by how many colleagues, workers in the hospital were hesitant, let alone my patients. And especially because my fellow staff, especially the non-physician staff, were very concerned and worried about the vaccines. And then I realized that this was a universal problem, but the reason I guess I was surprised naively about the healthcare workers is just because we had seen so much devastation, and so many healthcare workers had gotten sick. So I was just taken aback. Yeah. But I, started to talk and interact with healthcare workers at New York Presbyterian, where I work. Yeah. And then realized that the need and the desire for information was huge, and that there was a lot of misinformation and disinformation happening out there. Right. So what I've gotten very deeply involved in is many efforts around vaccine education and empowerment, including our course, which I think you're familiar with, but maybe you're not. Are you?
Can you mention the name?
The COVID-19 STEM Education and Empowerment Internship?
Yes. Yeah. Yes, absolutely.
So that's just one example. There's a group of us at New York Presbyterian and citywide that have been very deeply involved in doing lots of community education and outreach. Absolutely. And just our New York Presbyterian Cornell, we've reached, we've spoken to dozens and dozens and dozens of community organizations, going on the radio, going on TV, trying to reach out to the community. Yeah.
I believe there was another one called New York State Public Health Leader Training Program, which also merged with that.
Right, and that's something else that we were involved in. Yeah. So, the state is sponsoring a COVID education program. The federal government has sponsored one as well. But our internship was for, 6 of the 6 New York City medical schools, a group of us that do diversity work and stuff like that. Dr. Lynn Holden, who runs Mentoring in Medicine and is at Montefiore Einstein. Yes. Dr. Butts at Mount Sinai, Dr. Hutcherson at Columbia, Dr. Ravenel at NYU, and Dr. Booten Foster at Downstate. And then Joe Osborne and I from Cornell, the group of us decided to stand up a summer a virtual internship, and we're actually going to have another run through this summer. So keep your ears and eyes peeled for when we invite people. We decided to mount a Zoom internship over 4 Saturdays, 5 hours a day, which is quite a big time commitment. And we got 800 applicants from around the country, actually, and even around the world. Absolutely. And we decided to accept everyone. And so we did 2 cohorts, and we talked about virology and pandemics and public health, and how does the immune system work, how do vaccines work, about the COVID vaccines, about how to talk about vaccines. And we asked each student to do a social media product, a TikTok, an infographic, a video about COVID or about COVID vaccination, and that they should each commit to talk to 10 people about COVID vaccines. Right. And so we just finished our second cohort, and it was really inspirational. I think in both directions. The students loved, we brought some amazing speakers, and we really tried to provide a lot of information. But in return, the students, I think, underestimate how much they inspired us as their teachers and facilitators, and so it was really cool.
Yeah, I saw a lot of the TikTok videos from some of the students.
Did?
Yeah.
Good,
yeah,
excellent.
Good. Yeah.
Yeah, so that was kind of the idea, is that a lot of young people. There's so much mythology out there, and so one of the big challenges, I think, is right now is that the younger generation is very reluctant to get vaccinated. Right. But it's not just young people; it's across the board. Yeah. When you look in New York City, especially for people of color, there's a minority of eligible adults that and children, because now kids are eligible 12 and up. Right. that have been vaccinated. There's a lot of hesitancy. And so, I think that I think the key thing, and the reason we named it Community Education and Empowerment, was that it's not about twisting people's arms. It's about providing information and meeting people where they are, but also about fighting the disinformation, because that's one of the biggest issues is people, especially with social media, so much negative information that's wrong and isn't scientifically inaccurate going out there, so people don't know who to trust. So that's why we really wanted to kind of equip young people who are interested in science to in turn go out there and kind of be ambassadors of factual information to their communities. And so I think that if there's one thing I can say for young people in your city, that, like, including your Lehman comrades, it's getting the word out, getting informed yourselves, and getting the word out. Everybody that you encounter, talking to them. I mean, the guy in the grocery store down from the hospital is having trouble getting his vaccine. I have helped hook him up. I mean, at this point, it's no longer accessibility. It's really about, still that people are reluctant, and sometimes that there are logistical issues just because people work. But a lot of it is about people's, I think, two things. Number one, people's fears that are still out there based a lot of times on misinformation.
Right.
And some anxieties around immigration, cost, whatever. The reality, of course, that anyone can get vaccinated and that it's free.
Right.
So there are some really useful resources for information out there that I just want to direct people to.
Absolutely.
One of them I was involved in is called The Conversation, La Conversación, which is sponsored by an organization called Greater Than COVID. And that brings together African American and Latino doctors, nurses, and community health workers. And it has like dozens and dozens and dozens of videos in English and in Spanish that address a lot of the common concerns that people have about the vaccines.
Right.
But the other thing is that if anybody that you work with at your school has a community organization, a church or mosque or synagogue group, that temple group that that would like information from physicians. We have doctors that speak many languages. We have Arabic speaking doctors, Hindi speaking doctors, French, Creole, many languages, and as well as English and Spanish. And happy to reach out to any of the groups that you're working with, because sometimes students may be interested but may not feel equipped to answer the questions, but we can do it with you. So I wanted to just put that word out there. I would say if there's anything that is vital right now, is talking it up and getting the word out. And if there's any way that we can help you guys to then reach out to your fellow students and to your community, whatever organizations or people in your community, even if it's, I've told people, there's people in your family that are reluctant. Let's have a Zoom with your family. I don't care how big or small the group is. I really, at this point, it's one by one.
Right.
And you just want to empower people so that they can make the best decisions for themselves. Absolutely. And you have to respect why people are worried. A lot of it is disinformation. A lot of it is around distrust of the medical care system. And the reality is that the American healthcare system has not always done the right thing, where it's where people of color are concerned. And so people aren't crazy or paranoid for being worried. People are survivors and are being realistic and intelligent.
Right.
So you have to respect those realities, I think.
Absolutely. Thank you so much for sharing that. So guys, don't worry. I will link the website to the conversation. It's actually theconversation.com, but we will link it in the podcast. right. Thank you so much, Dr. Morales, for sharing your insight with us and all these other opportunities. I guess my next question will be about other challenges that you see so far in your experience as a family care physician, in the field in general, and also like what changes do you think will be appropriate in terms of the current medical system that we have?
I believe that we need universal health care in America. I believe that we need, ideally, a single payer healthcare system, which what that means is that there aren't, dozens and dozens of different insurance programs, but that everybody has the same insurance, the same access, and the same quality, hopefully. And so one of the things that I think is shocking to many people is when they realize the incredible disparity of access by income, region, because rural health is whether it's rural health or urban health, there are these problems with access to care, really widely variable quality of care, especially for everything, really. It's not only for high-tech severe illness. It even can be something as simple as access to childhood immunizations. It's really a very broad issue. Right. We spend a ton of our gross national product, which is the economy of the United States, on healthcare for a very poor outcome, and a lot of that is fueled by the disparities in the way that poor people, inner city and rural people, and minority people get their health care and the quality of that care. So one thing that needs to happen is universalizing it. What's happening right now is that what happened as part of the Affordable Care Act, also called Obamacare, there was a broadening of access to health insurance, which was great. And part of the most recent federal legislation under President Biden is that there were increased subsidies of those health insurances so that the premiums were lower. And then they broadened the application period of time so that, for example, right now, if you're uninsured and maybe, that you may be able to still apply to get low-cost health insurance in New York State, for example, and around the country. But that's, there's still millions of people that don't have any health insurance in America. And part of what happened with the ACA is that states could opt in or opt out to something called the Medicaid expansion. So for the very poorest Americans, lowest income Americans, Medicaid is a huge part of the safety net and covers a huge number of children. For example, is a major insurer of pregnancy and pregnant women. And so it's a really vital health insurance, part of the health insurance system. And many of the former Confederate states are the states that didn't fund the Medicaid expansion, mainly for political reasons, because it basically actually was free money. There was no state component from the state budget. And in fact, internally, many of those states' healthcare institutions lobbied for them to do the Medicaid expansion, but is really ended up being a very partisan issue. I think it's really unfortunate that health and public health is so politicized. I think it's a human right that everyone should have. Absolutely. But there's unfortunately, all this stuff ends up being like super politicized and partisan, unfortunately. So I think that's the number one most important goal is universal health care. But even when you have universal health care insurance, like in the UK, where they have a universal health plan, that doesn't mean that health care is necessarily perfect. And so There are lots of other issues around how the healthcare system is structured. One of the most important is that a healthcare system that has a primary care emphasis and that adequately funds and staffs its primary care infrastructure ends up leading to a healthier population as a whole. And that's kind of the opposite of how the American healthcare system works,
Right.
where primary care is starved and high-tech, really end-of-life care is what is most funded. So that's a mistake in set of priorities. And then you need to actually think about vulnerable populations because of poverty, because of racism and discrimination, and all the isms, homophobia and ageism and disableism. The reality is that all of that stuff translates into poorer healthcare quality and access for a lot of the population. And so that you need that. What you end up seeing now, for example, for the care of the poor, is that there's less spent on people that have the most need.
Right.
And so then there are bad outcomes and then everybody's surprised.
Right.
Whereas people that have the most need and may have the most chronic illness and the most challenges, there should be greater investment in supporting those populations.
Right.
But it's kind of the opposite. Of course, the reality is that we're also at a time of intense economic inequality, the most profound economic inequality in a century. This degree of economic inequality is part of what fuels a lot of the unrest and division in the country. It's not a surprise. The importance of it speaks to the fact that there are all these reforms that we need to do in terms of healthcare financing and the healthcare system, but that we also need to look more broadly, that health is not just health care. Health is related to the social determinants of health, and those include addressing income inequality, occupational safety, quality education, housing, all of the other things that affect the health of a population, and that really we as healthcare providers or people that are interested in health and public health need to think really broadly about all of those issues too. And so that's why at the start of our time together, I mentioned, whatever you go, there are many ways to serve humanity, and you don't have to be a doctor to do it, even though we want more doctors, good doctors out there. There's a lot of other things that we can do to also improve the health of our communities, even outside of healthcare delivery.
Right. And so our last question for today will be, what will be your general advice for pre-meds listening to us, who are vying to go into healthcare? What will be your general advice to them?
I would say, number one, be focused, and as I mentioned earlier, get help early before you need it, to try to make yourself as competitive an applicant as possible. There are major structural problems with the medical school application process, unfortunately, as well, including high-stakes exams like the MCATs, which disproportionately disadvantage low-income people, minority people, etc., because it's a biased exam, in my opinion. So there are all these hurdles that we have to jump over to get a medical education, which I find pretty enraging. And the fact that we actually have made so little progress in improving the numbers of people of color in medicine is pretty disgusting. But that said, part of it is also just hanging in there. So finding ways to nourish yourself, to nurture your calling, to not give up when people try to discourage you, because there will be people that will try to kick you down.
Don't give up.
I definitely had an advisor that was like, "Oh, you're never going to get into medical school," stuff like that. And so it's really, no matter where you go to school, no matter who you are, there's going to be someone that wants to kick you down. So you need to just keep your eye on the prize. Know that our community needs you, and then, but also, realize that there are going to be different phases of your career, and that there may be different paths that some of us take, and that we're all going to contribute in the end. And so that so I think that it's a funny dichotomy. You need to kind of stay focused and stay inspired, but also not realize that there are so many different ways to make a contribution. And as if you end up being a physician, that also that you then need to bring people up behind you, which is a lot of what my work is around. We have a diversity center of excellence at Cornell that has pipeline programs that focuses on bringing people of color and disadvantaged students into the medical fold, and so providing people with exposure and opportunities for mentoring, so that digging out all those possible sources of inspiration and support are also really important. But yeah, keep your eye on the prize, and keep your chin up, and don't let anyone discourage you. That's my most important advice, because a lot of it is the psychology of pre-med. It's just it can be daunting, and it feels endless, but in the end, it's worth it.
In the end, it's worth it. Thank you, Dr. Morales. Everyone join us and say a big thank you to Dr. Morales just for her time. She's a very busy person, but just making time to talk with us is a big thank you. Very grateful for Dr. Morales. Oh, Dr. Morales, can you share with us your social media platform so that our students can follow you?
Absolutely. Please follow me at Susana Morales, SUSANA MORALES M8 on Twitter, and our Diversity Center's Twitter handle is at capital WCM Diversity CTR. So please follow us. We'll be posting information for pre-meds and other stuff on there.
Thank you. Oh man, thank you, Dr. Morales. And so everyone, until next time, is bye for now. See you all in the next episode.